So snoring can happen occasionally also in normal individuals, but when it is loud, when it is repetitive, when it is very frequent, then it is troublesome. We see a lot of patients when we diagnosed with OSA, obstructive sleep apnea, we start them on therapy and automatically they're all medications like antihypertensive means BP medications, their diabetes medications are coming down. Patients who are who are smokers or who takes alcohol regularly just before going to sleep, they are at high risk of developing obstructive sleep apnea.
Okay, and you mentioned mood swings also. So does that mean that psychiatric patients are also at risk for getting sleep apnea?
Yes, definitely. Scoring is more than 3. You should definitely go and see sleep specialist and get evaluated for OSA.
Hi, I'm Aditi and welcome to a new episode on my podcast Aditi Shah Talks. Like every episode, we have a specialist for you today too, who will be discussing on a very important topic which is lesser known, sleep apnea, something that is lesser understood, lesser diagnosed, lesser treated in India. And just for y'all, today we have a sleep expert, and unfortunately, his biggest case study could be me, because he's none other than my own husband, Dr. Pravin Taware. Welcome to the show, and thank you for sparing your important time with me on this podcast.
Thank you for having me here, Aditi.
So, Dr. Pravin, snoring is a very common household problem, and the bed partner gets affected, the rest of the family members get affected, the kids also get affected. In fact, it's one of the most important reasons for divorce. And this snoring can have some problems affecting the health also. How can one navigate this problem of snoring? What are the dangers associated with snoring? Can you please tell the viewers?
Yes, as you said, snoring is at present is the most common cause of divorce in India. Unfortunately, India is, if you ask me, among the 4 most affected countries in the world, behind USA and China. India is giving more number of OSA patients. So we need to understand what is snoring first. Snoring can affect your partner and yourself as well. So what is snoring? Snoring happens because there is, when you sleep, there will be relaxation of your airway muscles, and that's why there will be vibration of air, what you take or whatever air goes inside. Because of that, there will be vibration of your airways, and that makes the sound a raspy sound, that is called snoring. So snoring can happen occasionally also in normal individuals, but when it is loud, when it is repetitive, when it is very frequent, then it is troublesome, and then it is the alarm of, like, one of the cause of snoring is OSA. It can affect the patient himself.
What is OSA again? The full form?
OSA is obstructive sleep apnea, and now we must have heard name pandemic. So like COVID pandemic or influenza pandemic, and now India is facing OSA pandemic or obesity pandemic, which is leading to more snoring. So snoring basically can lead problem to your partners as well, in terms of he will have a difficulty in sleeping because of snoring sound. That can lead to a fragmented sleep, which can affect his other systems as well, like his brain, like his CNS system, the central nervous system, or patients may get heart attack because of that. So you need to understand.
So you mentioned OSA, obstructive sleep apnea. What exactly happens in the body when there is snoring? Like, what happens in obstructive sleep apnea? Can you please tell?
So as its name suggests, obstructive sleep apnea means there is obstruction in your airways, and that's why this snoring sound comes. So obstructive sleep apnea. Apnea means a stoppage of your respiration during sleep. So what happens, as I mentioned previously, when air goes inside through your nose and your throat, air vibrates when there is obstruction, and that makes the sound of snoring or raspy sound. So in between of those snoring, your breathing may stop. Like you can see your partner while he is snoring, you can hear sound like gur 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 gur. But that gur means when there is a complete obstruction, then you will have pause of in respiration, and that pause of your breathing is called apnea. So this is apnea because of obstruction while you are sleeping during breathing. So this is one of the respiratory problem.
This obstruction is because of the airway walls itself, right? There's nothing else obstructing it.
Yeah, you can have both causes, like intrinsic and extrinsic. Intrinsic means the causes inside your airways, and extrinsic means something is pushing or something is giving pressure from outside. Most commonly it is pressure from outside, because when there is obesity, mainly you will have fat deposition in the central part of the body, from your neck to your stomach, means the central obesity. So there will be fat accumulation around your airways, and that leads to compression over your airways, which are already relaxed during sleep, and that leads to more obstruction, which leads to apnea. So this is obstructive sleep apnea. You may see these apneas centrally also, caused by centrally, that those are called central sleep apnea. Means your lungs are not getting, or your airways are not getting signals from your brain, and that time apnea happens, and that is called central sleep apnea. And these are obstructive sleep apnea related to your airways.
So what if it collapses, like it's momentary collapse, right? Why is it such a big deal?
So you are saying collapse of airways, but during that collapse of airways, you are not getting oxygen, and that's why there will be hypoxia or hypoxemia. Hypoxia means your tissues are not getting enough oxygen, optimum oxygen during that period. Or your tissues means a different organs, like brain is not getting oxygen during apnea, or your kidneys are deficient of oxygen, or your heart, your other systems, and that may lead to heart attacks, that may lead to strokes, that may lead to kidney diseases. A lot of times we see patients coming up with OSA, and those patients, if left untreated, they develop hypertension, they develop diabetes mellitus. As we say, everything starts from stomach. As our food is important, our sleep is also equally important, because all these metabolic disorders means when you get obesity, you are prone for obstructive sleep apnea. Once you get obstructive sleep apnea, you will get diabetes, hypertension, heart problem, and
stroke also, and heart
attacks also. You can cure other problems as well. We see a lot of patients, when we diagnosed with OSA, obstructive sleep apnea, we start them on therapy, and automatically they're all medications like antihypertensive, means BP medications, their diabetes medications are coming down. So that's why this is very important to address early.
But you said that this is happening in snorers. What about those people who don't snore, or those people who are not that obese? Can they get affected by?
Yes, definitely. So we need to understand, most common cause of OSA is obesity, but again there are some non-obesity causes where you have a structural problem. Like when you have very big jaw or very big tongue, that can obstruct your airways when you're asleep. When you lie down flat, your tongue may fall back, and that can obstruct your airway. When you have big jaw, that can obstruct your airway when you are sleeping. When you have big tonsils, that can obstruct when you have adenoids. So mainly these are in these problems, like enlargement of tonsil or enlargement of adenoids, are common in kids, but these are few causes of obstructive sleep apnea. And patients who are smokers, or who takes alcohol regularly just before going to sleep, they are at high risk of developing obstructive sleep apneas. So these are a few causes other than obesity. But as I said, OSA leads to diabetes and hypertension. Like that, hypertension and diabetic and heart patients, or congestive heart failure patients, are at more risk of developing OSA in their later life.
So you are saying that apart from the snorers and the obese people who've had a stroke, or who've had heart failure, or who've had kidney failure, are at high risk of getting sleep apnea. So they should be getting screened for sleep apnea.
Yes, definitely,
right?
Yes.
So when should a bed partner be suspecting sleep apnea? Like, what would be the signs or symptoms?
Yeah, so most common symptom is snoring, as we discussed. Then other one is observed apnea, that is seen by the partner.
What is
And
that?
the patient, observed apnea means a partner is saying when patient is sleeping, patient is snoring, gur 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 gur, and there will be pause for 10 seconds, and again patient is snoring.
You mean to say the chest won't be rising?
So chest won't be rising, patient won't be taking like breath, or patient is not breathing, and that is called apnea, and that is observed by spouse or family member, and that's why it is called observed apnea.
Okay.
One of the most common symptom is tiredness faced by patient. Like at the end of the day, patient will feel tired. Most important is excessive daytime sleepiness. Patient will sleep or he will doze off even while watching TV, even while reading, or even while watching something on your phone,
Even
or
while driving.
even while driving. That is most important. A lot of times we get patients who realize they have some problem when they face accidents because of napping during driving. This is one of the important thing. Other thing is when there will be loss of libido, there will be loss of concentration, difficulty in concentration in work. A lot of times you have irritability. When you get up in the morning, you will have headache, or sometimes you will just feel heavy headedness. Mood swings will be there, more mood swings. Your spouse or your family member will come up with like patient is having more mood swings in last few years. And most important, sudden increase in weight over a period of couple of years. There will be drastic weight gain. So if you ask me, there are some studies which says 10 to 13% of increase in weight can increase the risk of 4 to 5% of getting OSA in that patient.
Okay, and you mentioned mood swings also. So does that mean that psychiatric patients are also at risk for getting sleep apnea?
Yes, definitely. So psychiatric patients, where patients who are diagnosed with anxiety depressive disorders, or patients most of the time they are depressed because they can't concentrate in their work, they are very irritable,
having mood swings very frequently, and
okay. Yeah.
So they should get screened for sleep apnea. So what is the best screening tool? Of course, apart from visiting a doctor when he takes history, apart from that, is there any particular good test available, which is the ideal test for sleep apnea?
So before going towards ideal test, I'll like to tell about a scoring systems or a screening systems, even that you can do it at your home. So that's called stop bank scoring. Stop bank is very easy to calculate also, and you can just Google it and you put your numbers and you will get the scoring. If that scoring is more than 3, you should definitely go and see sleep specialist and get evaluated for OSA.
Okay.
Now it comes to what is the definitive test for OSA. So that's called polysomnography, means diagnostic sleep study. Here you have different diagnostic sleep studies like level 1, level 2, level 3, level 4. So most importantly, you need to do level 2 study or level 1 study if available. Why? Because in level 2 and level 1, that includes EEG. EEG means encephalogram, electroencephalogram, which can detect your brain activity also, brain waves also, and ECG, which is electrocardiogram. So level 2 if possible, level 1 if possible, otherwise level 2 you can do. So those there are number of agencies or number of hospitals are providing level 2 sleep study at patient's home at their comfort. So they will come to your home, they will attach ECG leads, EEG leads, belt over your abdomen, belt over your chest, and then they record your sleep whole night, and that's called OSA. So what they record is, they will record your snoring, they will record apneas, hypopneas, how many times your oxygen is dipping down, how many times you are moving here and there, how many times you are having a fragmented sleep, how many times you are getting up. So all that is...
So you mean to say deep sleep gets recorded because of the EEG wires that are on your brain.
Yes.
You get to know exactly how much deep sleep, how good the deep
How
sleep
good the
has
sleep
been.
is.
Yeah.
And
So that and level 1 and level 2. What is the basic difference between the two?
so level 1 is a recorded sleep study where audio visual recording will be there, and one technician will be constantly observing that person.
Okay.
So that becomes level 1, which happens in house. In house means in hospital, where you have a sleep study room, which is soundproof room. You have camera, you have mic there to record your activity and record your snoring, and one person is constantly seeing. That is level 1. And level 2, where you do at home, that is called home sleep study. So there only that recording will not be there, and one technician will not be there who is looking after your sleeping pattern. That becomes level 2. For adults you can go for level 2, but whenever possible level 1 should be preferable. For pediatric age group, for kids, level 1 is very important, because there we need to see their movements. Other than obstructive sleep apnea, they have different sleep problems also. We'll have to see a restless leg syndrome, where they will move their legs, their hands continuously throughout the sleep. They will have different sleep problems, like sometimes night terrors, nightmares. All those are recorded when you have sleep 1 study. So that can be missed on sleeps 2 study. That's why if kid is coming with sleep apnea symptoms, screen with or do step 1 or level 1 study. For adults, you can go for level 2 study.
Okay. And what is level 3 and level 4 missing out on?
So level 3 and level 4, where so it's all depends on number of channels, what you are recording and how many channels you are using. If your EEG is not getting recorded, or your ECG is not getting recorded, then there is no point of doing sleep study. So there are now new gadgets in market, where you have Apple Watch or other companies watches, those you record, and a lot of times patients come to us like, you can see my sleep, or you can see my sleep pattern, heart rate and everything at my watch, and you diagnose it. It is very difficult to tell, especially in kids. You cannot rely on those gadgets. So you need to do a diagnostic sleep study or level 1 PSG, which is polysomnography.
All right, got it. So once this sleep apnea gets diagnosed on the level 1 or 2 sleep study, what is the next step? What is the most effective treatment we have available?
Yes, very important, because when you get diagnosed, it is equally important to address as soon as possible, because it can have a problem with other systems as well, as we discussed. So the definitive treatment here is continuous positive airway pressure, which is called CPAP, or you must have heard BiPAP. So CPAP or BiPAP is the definitive treatment. There are some adjunctive treatment. Adjunctive treatment means there are not definitive, but you
not
can
most effective.
Most effective. If patient is not willing or he is not happy with CPAP, then we may try those adjunctive therapies like oral appliances, putting balls over their back, so that they will sleep on the right or left side or lateral side of side during sleep. Okay. Very few patients will be comfortable with oral appliances, because there will be dribbling of saliva overnight. You will have discomfort while sleeping when you wear those oral appliances. That's why the definitive treatment is CPAP, BiPAP, and you should understand the disease and ask the doctor whether you need CPAP or not. So doctor can decide on the scale of your AHI. So what is AHI? AHI is apnea hypopnea index. The value you got from a sleep study. So that is very important. If moderate to severe patient, OSA patient is there, the definitive therapy is CPAP or BiPAP. There are other therapies where, if it is related to lifestyle, if patient is obese, obviously he need to reduce his weight.
How much weight should he be reducing?
So it depends. At least if he reduces 10% of his weight, the risk of OSA reduces. his BiPAP therapy may go off after some time.
You mentioned about those nasal strips. So these days we have a lot of snoring devices available on Amazon, and people have been trying to get hands on them, thinking that it will be effective. Are they actually evidence-based effective treatments?
So those are nasal strips or nasal dilator. You will have to put them on your nares so that your nasal cavity or nares will dilate. But when you have problem inside in your throat, as we mentioned, retropalatal means behind your palate, there will be fat accumulation. That obstruction won't get cured, and that's why you will have continuous snoring. So that's why I mentioned definitive treatment is CPAP.
Okay, got it. Also, you mentioned about kids that sleep apnea is common in kids also with night tremors, etc. Why would this be happening in kids? Do they, because they don't commonly snore, right?
Yes, very important. So as we see a lot of kids nowadays coming up with obesity, mostly adolescents. They are like, if you ask me, India is second leading country in obesity in adolescents.
Okay.
So a lot of times they snore, they come with loss of concentration, missing on their schoolings, and that's why they come to our clinic to show because of snoring and increasing obesity. So when leading questions we ask, that time we come to know this patient, they are more on gadgets, new electronic gadgets, and because of that they are at risk of developing depression, and that's why they are more prone to develop obesity as well. So if you take kids who are younger than 2 years of age, or they are infants, then they might get adenoid. Adenoid means there is one gland which is there in your, like tonsil like gland, which is there in your nasopharynx. So whenever there is enlargement of adenoids, whenever there is enlargement of your tonsils,
by nasopharynx you mean the back part of the
back part of the nose, rightly said. So, and whenever there is allergic rhinitis, patients will have
allergic rhinitis is when there is a lot of allergy of the nose happening, where there is runny nose, etc. Multiple episodes of sneezing and recurrent cold, stuffy nose. That is what is allergic rhinitis.
Right, and so that's why they get nasal obstruction, or when they have tonsils, they will get oral obstruction, and that's why we need to screen them very carefully, because they don't snore, but parents need to watch them carefully, their respiratory system, like when they take breathing during sleep, their abdomen should rise, but here there will be paradoxical movement of the abdomen and chest. So during breathing, abdomen will go inside, and this is paradoxical movement.
So you mean to say that normally the abdomen should be rising when you take a deep breath, but in this case the abdomen will go inside when you are breathing in.
Rightly said. Yes, and child won't like, he won't be playful, like he will have active, he will have disturbed sleep, very cranky, and these things they need to understand, they need to observe.
Also, Dr. Pravin, in your career as a sleep specialist, what has been the most interesting case of sleep apnea that you have ever come across?
Yes, recently I have seen one patient around 15 days back who had very high weight, which he was around 110 kg, and he was snorer, and then he got diagnosed with OSA. He got divorced because of snoring, and when we start CPAP therapy, around 3 months later on, his weight reduced to 98, and he was very motivated for reducing weight, and finally on second visit, his wife had come with him, their life as well.
Thank you, Dr. Pravin. I hope I don't snore, right?
No.
Yeah. Thank God. Okay, fine. All right. Thank you so much for these wonderful insights, Dr. Pravin. So I hope you have found this episode on sleep apnea extremely valuable.
If you find all these podcast episodes informative, please like, share, and subscribe to this channel called Aditi Shah Talks.